My first call was a maternity, which we brought here to Lancaster General. I had no training, and she delivered the baby 5 minutes after we got to the hospital. So I don't know what I would have done if she had done it in the EMS.
First memorable call I've had that I can remember of was a trauma call where my motorcyclist had his leg amputated from the accident. Even though they weren't able to save his leg, they were able to save his life. 2
Amish children who had fallen through a silo. So my very first call, I had to work a pediatric arrest by myself.
When we arrived, there was a person in the kitchen saying that there was people there trying to kill her. We got her in the ambulance with some assistance, and she looked at me and said, "I know you. You have hand grenades in that bag." I was carrying the medic bag. The driver at the time looked at me and said, "George, you're driving." I've never touched an ambulance. I didn't know where the hospital was.
It was a car accident, and I think there was 5 to 6 people in it, and there was a young man that was killed at that accident, and that was my first call.
One of the first calls I had was a double entrapment. Never saw anything like it. Very scary. I saw one gentleman ruin his life because of alcohol. Made a very big impression on me.
The person was in cardiac arrest, began CPR, and eventually the person walked out of the hospital. That person's daughter then became an EMT because of the fact that EMS saved that person.
The most memorable call that I remember is delivering my one and only baby on my daughter's first birthday, which now she's 22, so it would have been 21 years ago. And it was on the kitchen floor.
One of my very first calls I've had was when I first started out as an EMT, was a 5-year-old that actually got struck and ended up dying. You know, to this day I can still recall basically all the details of the incident. Yeah, it stuck with me.
Okay. It was a infant that was playing down behind a business, and a industrial-sized steel door fell on top of the child. Yeah, it was a little nerve-wracking being my first call.
When I was 19, I was in York City in York County, Pennsylvania, and I delivered my first baby, and that was on the floor of a house, and now that baby's full grown and an adult.
My first call as an EMS provider occurred in 1979. It was a cardiac arrest in a small tavern in a local community, and I actually transported my patient in a Cadillac ambulance. Been in it that long.
It's hard to recall one specific incident in my career at Lancaster General Hospital with the EMS community here, but there have been many, many positive interactions. I can't think of any particular event that would probably summarize the care more than the nickel mine shooting. And just seeing the amount of dedication and the care that they provided for not only the victims but the family members that were affected, and then the way the community supported the EMS providers themselves too in the aftermath.
The biggest change I've seen in EMS is the quality of care and the providers with the technology that we have now that we had not back in the 80s.
The development and use of 12 leads pre-hospital in EMS to more accurately diagnose STEMIs and MIs in the field.
And things are more aggressive in technology, meaning like the computers in the medic units, and how to get the patient out of the house with the new equipment they come up with. They thought of saving people's backs.
It used to be that you would call, we would come out and get you and take off for the hospital. And now the care is, we get on the scene, and as a paramedic, we bring the ER to you.
Back then we ran with 2 paramedics and an RN. Since then, the MICUs are an EMT and a paramedic, so we now do more today than what we did years ago with less staff.
I've seen the changes in education as far as length of time spent training for this particular career.
What we used in 1986 compared to what we use now, you can't even begin to imagine. People who weren't there couldn't imagine what little we had at the time compared to what we run with as a standard piece of equipment now.
I've seen call volume go way up. We've been busier than we've ever been.
And now we have standing protocols where we're permitted to do a very large variety of skills, tasks, before we have to contact a physician.
Communication-wise, I think it's great what we have now in communications. When we first started running, you might have had a radio, but it wasn't much worth anything.
Originally, when I started, we would have a little bit of paperwork to do. You could get it done on the way to the hospital. Now it takes you an hour.
Training's got more in depth, and there's a lot more that we need to know and be aware of.
We've really seen a change in cardiac resuscitation in the past year. We have instituted new technologies, including hypothermic cooling, new CPR devices, intraosseous lines, and we're seeing quite a bit of change and hope for the sudden cardiac arrest population.
Today we see people entering the EMS field with a concept of it being a career.
The one thing that really stays the same is the provider's compassion for helping people. I think that's one thing that never really changes.
I stay involved with EMS and fire because it's my passion. It always has been since I've been a kid. And plus I also follow generations that have done this in fire and EMS.
Even a bad day is still an enjoyable day at work.
Just to help those younger than me and teach those that are younger than I am to maintain the professionalism of EMS.
It's something I got into really early. I enjoyed it, and I still enjoy it today.
It's making a difference in my patient's outcome, the family.
Many years ago, there was a young child who fell into a pond, and we did CPR on him, and he survived. And when his mother sees us, she always thanks us for that child. So that's a reward right there.
Somebody calling at 3 o'clock in the morning for Christmas Eve when you know they're perfectly fine. But they say, well, I had some tea, would you drink a cup of tea with me? And stuff like that,
Well, the first day that I worked as a medic, I probably was an hour early for my shift. As of today, I still go to work 25 minutes early, and I feel like I have the same enthusiasm as I did that day 31 years ago.
I'm happy to say that I'm probably one of the only people in the world that actually get up and say that I don't have to go to work every day because I truly love what I do.
It changes every day. There's no 2 days that are ever going to be the same.
I can be running calls in the city, shooting, stabbing sick people, and the next minute I can be down in the rural area of Strasburg or something like that running a farm rescue.
It's not repetitive, I guess you could say, is why I really like it.
Going home at the end of the day knowing that you've made a difference in someone's life is very gratifying.
I'm not sure what else I would do if I wasn't doing EMS.
You folks in EMS are important to us in the emergency department because you're our eyes and ears to what happens in the community, in people's houses, at accident scenes. Sometimes you're our only source of information about the patients, and so we really appreciate everything that you do and the information that you bring to us.
Having the medics out there, getting things started, identifying critical patients and being able to act appropriately makes our job a little bit easier. So that way, when the patient comes in, care has already begun.
And we really appreciate all the compassion that they have for the community that they serve.
This is the trauma team. We want to thank all our EMS providers for the wonderful care that they provide our trauma patients on a daily basis, helping to get them here safely and expeditiously. You guys truly are the unsung heroes of our trauma care system.
I think we're very, very privileged to live in Lancaster County and to have the professionalism both from volunteer services and from paid services.
I don't think you hear it enough, but thank you very much for your care and commitment to our community and to our loved ones. Thank you.
We have a litany of cases that we know that had it not been for the EMS providers, outcomes could have been dramatically different. And those opportunities to touch those people's lives have definitely made Lancaster County a great place to live, and we have great providers. And I just want to take a moment and say thank you.
Thank you, EMS.